Everybody needs to check up. So I am Dr. Lisa, the President CEO of Raising the Future Parents Anonymous. And we're very glad to be here. We've been part of the CFRA association since it started.
Thank you, Lisa. Do you want to introduce the rest of your team now or when you start your presentation?
I don't know. Do you want to switch your slides? You seem like you had a setup what you wanted to do. I didn't want to change that.
Yeah, no worries. I can just go through the quick CFRA ones and then I'll hand it off to you.
Okay, that sounds good.
Great. So welcome everyone to our Community Voice webinar series. Today, our guest presenter is Raising the Future and talking about shared leadership. So we have a few of the folks from Raising the Future here today with us. And just a quick introduction, I'm Victoria Hartman. I'm the CFRA program manager. Michael Williams is our policy director, but he is on vacation this week, so he's not here today. But I will hand it off to Sadie to introduce herself, as she's a new team member for us.
Hi, my name is Sadie Crow, and I am now a part of CFRA for the program support.
Thank you, Sadie. Okay, so here's our agenda for today. We'll do some welcome and introductions. So if you could put your name, organization, and county into the chat, that would be great. We have our guest speaker presentation next. So Raising the Future will present on their shared leadership structure and their program. There will be opportunities for questions and answers. We'll have some guided discussion questions, and then we'll talk about the upcoming events after that. So just an overview of CFRA. Our vision is a strong, cohesive network that promotes success and well-being of families. So this Community Voice webinar series is very much aligned with that. Our mission is to connect FRCs and allied organizations in a statewide network. So this is a great opportunity for you all to share best practices and learn from each other. Convene family strengthening leaders for networking, and communicate the value of FRCs to strengthen families to policymakers and to the state. So really involving our families and that community voice when it comes to our legislative advocacy as well. And with that, I'll hand it off to you, Dr. Lisa.
Okay. Are you going to give me control or just ask you to change the slides? What?
You can ask me to change the slides. Yeah, I think that might be the easiest.
Okay. Okay. So thank you for having us here today. We are very excited to share what Parents Anonymous and Raising the Future has been doing for the last 53 years. So parent leadership and shared leadership are the core values of what we do, the way we design policy, programs, implement programs, conduct research, do advocacy at the local, county, state, and national levels. We are an international organization. We're an international family strengthening organization. So I've been the president and CEO for 30 years. I just celebrated my 30th anniversary. I know I was a baby when they let me in the door, so you don't have to guess my age, which isn't true, but and it's been a pleasure to be part of this international movement and this evidence-based program, which still stands with parents, children, and youth nationwide. Janice, you want to introduce yourself?
Yes, I'm Janice Roots. I am Vice President with Parents Anonymous Raising the Future. I have been with the organization for, I think, going on 5 years now, and been involved in many, many aspects of what we do. And certainly a very strong proponent of shared leadership, and particularly meaningful shared leadership. And I'm really happy to be here on behalf of Parents Anonymous with Dr. Lisa today and the rest of our staff.
You can change the slide. Okay, so we're going to, the chair of the California Parent Leadership Team, Antonio Rios, unfortunately had a personal emergency this morning and will not be able to be with us, but we're going to share. She has graciously been involved with Parents Anonymous. Some of you probably have already met her because we did another webinar with CFRA. When CFRA got the money to expand services in the state, it was required that all the CFRA grantees would work with Parents Anonymous. And so Michael and I and Antonia, we did a webinar last year sometime. So people probably met Antonia at several meetings or in committees. She has a powerful personal empowerment story, but she also graciously, she and her son agreed to be on Spectrum One News to share a little bit of their life. So we're going to share that with you. It's just a couple minutes.
I need to be able to share. Okay, thanks. Okie dokie, 1 second.
Sitting alone on the couch is a rare treat for Ricky Alvarado. He has 6 siblings. The pandemic has made him feel trapped in the house with his siblings and has led to fights and frustration.
All the arguing and just not being able to handle the arguments with them.
He needed a way out, a way that was healthier than the thoughts he's had in the past.
When I was 11, I tried, I searched up ways to kill myself.
His mom has his name on her leg and memories of that difficult time in her mind. Antonia Rios believes those thoughts were a side effect of medication, but she didn't want the pressure of being trapped in the house to cause any harm to him or anyone.
And all those personalities all in one area and not being able to, it was overwhelming.
Thank you for calling the California Parent and Youth Helpline.
They both called the helpline. It launched in response to the pandemic. Trained counselors and social workers like Matt answer between 20 to 40 calls a day.
The phone really is ringing off the hook with parents and caregivers and with children and youth. We cannot pick up the phone calls as fast as they are coming in.
He says calls last an average of 26 minutes, and convos happen on the screen, too, via text messaging. Matt says parents and youth are struggling with COVID cases in the classroom and other pressures of the pandemic.
Children and youth are getting angry at home. They're getting violent. We're getting more and more intense calls than we ever have before. And it's completely understandable because of the pressure cooker of the pandemic, being at home. Kids are acting out, and parents are needing help with this.
He's able to help by connecting families to resources and support groups in all of California's 58 counties, which comes at a cost. Parents Anonymous CEO Lisa Payan Berlin calculated the cost of running the helpline at $1.5 million and says more is needed for it to keep going.
The state has funded us at only $1.5 million a year, only through next June. And we're really appealing not just to state government, to businesses, to private foundations, to powerful philanthropists in the state to really come out and support parents. Because without a helpline, they have nowhere to call to ask for help.
Calling for help is now part of her routine.
Oh, the helpline was like almost a daily for me.
And for Ricky, it was a listening ear.
It felt good because it's just, I get to talk to someone else instead of my siblings.
It gave him the space he needed.
Thank you, Janice, for sharing that.
Sure, let me try to get rid of the share here. Okay.
So when we, you can go back to the presentation. Thank you. The bravery that Ricky and Antonia had to put themselves on TV, you know, when you put yourself on TV, it's picked up all over. And the courage that parents and youth have to talk about these real issues, suicide, is amazing. I must have asked Ricky 10 times, are you sure you want to do this? Because somebody might see you walking down the street or at school or in the store, and they might not talk nice to you. Everybody doesn't respond to somebody talking about a problem in a positive way. And everybody doesn't have a positive approach, especially to a young child of color. And he said, no, I need to do this, Dr. Lisa. I need to help the next person who's struggling. And that's the power of Parents Anonymous. He learned that in Parents Anonymous. He attended Parents Anonymous support groups for more than half his life. And in the giving you get, and he keeps on giving. And the same thing with Antonia, deciding to share her story. If you can move on the slide. So we wanted to emphasize today, when people talk about community voice, and we saw what CFRA was trying to do, we're going to kind of shift your thinking a little bit. So open your mind up. I know it's the afternoon. You probably just had lunch. Your stomach's growling. You're thinking, oh my God, how long are these people going to talk? Eat your lunch, nourish yourself. Somebody brought me one of these dragon fruit drinks because they know I like it. I might sip on that. Taking care of ourselves is really essential, okay? And so when we talk about ensuring meaningful parent and shared leadership, if you see us talking about something and you don't think we're hitting that, you need to come back to us, because in Parents Anonymous, we do nothing without parents. We don't change our website. We don't do a Google ad. We don't decide a policy without parents. We have a national parent leadership team, a California parent leadership team. We have parents who have benefited from the program, who work as peers in the organization. In everything we do it in shared leadership, not amongst ourselves only, but with those we are here to serve. Because we can't decide for them what they need. We need to ask people what they need. I did not become a social worker to tell people, you need to do this, this, and this. I became a social worker to ask people, how can I help you address whatever issue you're dealing with? Okay. So we just created this thing, which includes our Jedi approach, that we're about supporting the empowerment journey of others. Language is very important. We own nobody. In Parents Anonymous, we don't use possessive pronouns. We don't dare call anybody a client, because the root word of that is beggar and cheat, which is why medicine never used it. And there's no financial transaction between a parent or youth who calls the helpline or comes to Evidence-Based Parents Anonymous and us. There's no financial transaction, okay? You sure you want me to keep saying, change the slide? Okay. Thank you. So when we define, this is a whole group of Parents Anonymous parents and staff, meaningful shared leadership is achieved when parents and youth with lived expertise, and their expertise may be like Ricky's, he wanted to kill himself, okay, suicidal ideation. Somebody's expertise may be, they've had struggles with mental health issues, other mental health issues, drug and alcohol, domestic violence, being homeless, anything that could affect them. We consider that lived expertise, not lived experience. I have lived experience driving a car. My children would tell you I'm not a great driver either. They're adults, but hey, lived expertise is something, it's putting a value. So we are very particular with the words we use, which we're going to emphasize with you. So we first had a reaction, I'll just finish this, to join with staff, parent, policymakers, agencies, and other community groups to successfully collaborate to implement a dynamic vision by sharing responsibility, expertise, and resources to realize better outcomes for families and communities. If it doesn't result in better outcomes, why are we doing it? Because it's a slogan? Because we think it makes us feel better? Well, that's not what we do at Parents Anonymous. We do things because we can measure the difference. We've written books and book chapters on shared leadership to prevent child abuse and neglect. I can send that out as a resource with a group of people all around the country. We have been holding to this value since we were created in 1969. Next slide. We actually did an ethnographic study across the country with different types of parents, different backgrounds, different religion, different family structures, to look at what were the 10 steps that people used to develop their own leadership. Obviously, there's not shared leadership without parent leaders, okay? So we first have to begin with, how are we identifying these parents, and this could be applied to youth too, that people talked about a commitment to leading and participation, regular participation in the group. This related back to the group, exposure to other parents, so that people weren't one and done. They were doing it with others. Recognition that they needed to get involved or take action. Encouragement from others. That people used to say to me all the time, well, why do you call me a leader, Dr. Lisa? I'm not a leader, I'm just like a regular parent. In Parents Anonymous, we consider everybody who walks in the door to be a parent leader, period. We don't have any other name for you. If you just want to be called Parent Susie, that's great. But we identify you as leaders because you made a choice to change your life, to improve the situation, to come to this evidence-based program or call the helpline or any of our services. Receiving feedback so people mirror back and get the support. They get feedback, getting stronger and becoming a role model. Now this shows steps, but the research, this was done 20 years ago, this research, 25 years ago. It needs to be more like an elliptical, meaning it's not, oh, you went to step 4, you couldn't have gone there. because people go back and forth and journey in a variety of ways. We were the first ones to talk about parent leadership. You can move on. So now, if you actually hit the space bar, Victoria, thank you, it'll show you how this moves. So the goal is, so just stop there for a second. So this is me as a staff person asking Antonia to participate. So this arrow is going distinctly this way, right? So I'm doing a focus group. I'm doing a strategic plan. I'm putting together a prevention plan, a strengthening family plan. I'm getting involved in Family First. I'm getting involved in reforming the mental health system, a variety of things, the developmental disability system, more food, clothing, and shelter, accessibility, concrete supports for parents. Whatever you're doing, we're saying the first step is to ask the parent to participate. You can hit the space bar again. You can do it a couple times and you'll see us move. See, isn't that cool? We kind of move there. And so Antonia decides, I would like to get involved. So it's her choice. You might ask 10 parents, they're too busy. I don't know how many parents I ask all the time, would you be on the team? Could you do this? I'm too busy. I have 2 jobs, 2 little kids, and it's the coronavirus, you know, and people's lives are very different now. How much do you want me to volunteer? What do you want me to do? Et cetera, et cetera. The next step. She and I both work together to define, you can hit it again, engagement. So what is the role you want the parent to have? What is the initiative about? Are they helping to shape the initiative? Does it already have a goal, a timeline, a framework, et cetera, or not? And so that's where the arrows are showing you that the ideas and the work is coming from both individuals or groups of individuals, multiple staff, multiple parents. Okay, hit the return again. And then in the last step, in order to achieve shared leadership, the arrows are going both ways all the time. There is not one distinctive point that this partnership results in shared leadership. And shared leadership is a brand that we own, so we always use it with an R. And this describes the process model to sort of set up where we're going. Thank you. You can go to the next slide. Okay, Janice, you can jump in here. So we decided to give you a list of things to think about in what ways parents could have a role. I just want to say something about community voice. People all the time say, we need more voices. And what I say to that, I'm a very literal thinker. It's just the way my brain is wired. My voice is not me. My voice is one part of me entirely as Dr. Lisa, mother, president of PA, wife of 42 years, you name it, friend, neighbor, community member. I have many parts of me that make up me. You're not splitting me from my voice. And I would just suggest in this initiative that just talking about having voices is like, did anybody listen to that? It doesn't refer to a human being, except voices do come from humans. It's like when people say children and families. I said, well, what do you mean? Do you dial a family up? What happened to the parent? And I think we in the family resource, and I've been part of the family resource movement since it began nationally, locally, you name it, and raise the same issues. Are we talking about doing things to people or partnering with people in shared leadership and asking them what they need, what can we provide, how can we build this journey together, which is why we came up with this brand, Raising the Future. Raising the Future, the idea of this brand was to bring all sectors together, all people, no boundaries, and that we're all raising the future. It's not just the parent all alone who ends up being homeless, who are like, well, God, what happened to them? It's like, how can we prevent homelessness? How can we deal with these things earlier and be there as a community with people, money, services, institutions, et cetera, but it starts first with people. And oftentimes people skip entirely over the word parent. If the one thing, I'm always pleased when people do say parents, and oftentimes it just says, we mean that when we say families. You don't mean me, mother of Jeremy and Emma, when you call me a family. A family is my whole family. It's a unit. It's not one human being. And if you need to call me up, you don't call a family, you call the parent. You're not usually calling a minor, you're calling the parent or the parent in charge. So Janice, you can jump in here. One of the things I want to emphasize in the middle is that every county, you all know, has CBCAP money, right? And OCAP is doing all this work. And we as advocates in prevention need to make sure that we are at the table with parents side by side with us. Now, we do trainings for this, we do consultation. We've helped every county in this state over the last 30 years look at this issue on some level in traditional child welfare. And now we're working in mental health and all these other fields. The school system, et cetera, call us and say, how can we engage with parents? Not just have a site council that nobody listens to or 3 people are on it. You know, every school in California has a site council made up of parents. It also has a council for people of color based on the ethnicity. If there's one African-American family, there's one, I forgot what it's called, AAPD.
Apex, yeah.
Yeah, has to exist. So why is that? If nobody's listening to them and they're making no impact. Parents don't feel anybody's listening to them. So we as agency people, even in my role as being a mother, but I'm here in my job, I need to think about how are parents being discounted, and I need to bring them with me to every meeting, every committee. I'll tell you a story. I was asked to give a talk, this is 20 years ago, on parent leadership. And I said, okay, Graham, bring a parent. They said, no, you can't. I said, well, I'm not coming. It's 25 years ago. Now people don't dare do that, okay? They ask us to speak, we always come as 2. They asked us to be on TV. Did I do the talking on that show? No, it was the parent's journey, the parent's story, and the adolescent story. They just circled back around to me to explain about what we were doing, okay? But it wasn't about me. Going to the legislature. The legislature wants to hear from the parents who you have worked with. You telling them, I've served 1,000 meals, I've done this, I've done that, and done that is great. But having them hear how vital it is to the people in the community is the essence of what we're about. Not talking for people, but supporting them to become the parent leader they want to be. Some people do not want to go on TV. Some people do not want to talk to the legislature. Some people want to write their story out. Some people want to show up at a community meeting. Everybody has different interests and skill sets. But we support people through this whole journey, whether it's policymaking, advocacy, family first. You know, the state, if you don't know, gave $242 million to the counties. And they're supposed to be partnering with parents in the community. Every county agency, every county child welfare agency is supposed to be partnering with the community-based entities to provide family first services. The county Department of Child Welfare does not provide prevention services, okay? We all provide prevention services and need to be at the table with parents. And the state has put that in as a requirement in those plans. And there's $242 million on the table right now for every county. In January, I think it is, has to put together a plan, and we all need to be there. Think tanks, coalitions, decision-making bodies, any place we are asked. I didn't even put the media on here. Every time the media calls us and wants a story, I said, well, you want a story from a real person? Absolutely. I mean, they're going to me to get a story from a real person. And then I'm just part of that, whether it's Univision, on our website that ran statewide with a mom talking about postpartum depression and how it was going to turn into psychosis until she started going to Parents Anonymous and use the helpline, et cetera. And those stories really make a difference because they reach out to the next person who needs help. Maybe they change a policymaker's mind. I don't know. Maybe it opens up a fund or two. Hey, I need to donate to that, right? But surely it helps somebody say, hey, I'm like them. I can relate to that. I know somebody who needs help. I need help. And that's what we need more and more of. Not the government hounding on people, classifying people, treating them in a racist, sexist, and classist way. We don't need any more of that. We already have the results of that. And the data bears out. It's not an opinion. It's bared out in the data in this child welfare system. Janice, you want to add anything here about how we work in shared leadership?
Well, I think one of the things that we need to kind of just emphasize is that the reason why shared leadership can be meaningful is that you don't just bring people in on the end and say, oh, what do you think about that? What we've done or we planned or we did already. You bring them in the beginning and say, what should we do? Give me your ideas. And many of us work in this field or in many ways to support parents and their children. But I have never seen lawmakers more impressed or affected than when they actually speak to parents who are not always involved, but have had issues and can give their story and really give them good reasons why they need to think differently or continue something that's good. So I think it's very important for us to look at shared leadership. It's hard for people to give up power once they get it. And this is, but it's important that we allow other people to use their power as well, because you don't have to give up something for shared leadership. You only have to add something. And so that's why this is really important, and important in an implementation across not just Parents Anonymous, but wherever families are involved and have needs. We need to consider how we help their parents and their caregivers get involved. And even if they can only be a little bit, it helps them feel more powerful. We do National Parent and Youth Leadership certification training. And it's because leadership is extremely important, but knowing that you have the power to be a leader is even more important, because then once you've realized that, then we can go about helping in the training of how do you organize, how do you advocate? And that's what all of these are about. How do we help make change, and how do we enlist others in making that change? Because the power really comes in the numbers. And I think as parents work to do this, they learn this in Parents Anonymous groups. And as they come together to do different things to change themselves, to improve their families, their communities, then they really understand leadership, and then shared leadership and mutual support of each other as well. Let's move on. Next slide, please. Thank you. So if we would be remiss if we didn't give you something about the history of Parents Anonymous, because Jolly Kay, our founder of Parents Anonymous, along with social worker Leonard Lieber in 1969, which means that Parents Anonymous has now existed in 7 decades in this country and in other countries around the world. They came together, she came together with him to try and find a solution to the fact that her child, was, removed from her home. And that when they decided to, let her have her child back, she had not had any kind of assistance in getting better, improving on her recovery journey, okay? And that was very frustrating to her, and it should have been. And so she went about the process of working with him and enlisting other parents, first mothers, and then realizing that fathers also need this help, enlisting other parents, because lots of people were struggling. They developed the mutual support and shared leadership model, came together in groups to help each other, and then over time have developed into an evidence-based program by doing the work to research what we're doing, what is done in Parents Anonymous group, and why that works, and how do we continue to do that with fidelity tools and the like. She is the first parent, for all we know, right, Dr. Lisa, who's ever sat in front of Congress and said, we need help. And the first time that an organization was ever put into legislation to be funded, and that was in the CAPTA bill. This is important work we do. We have been advocating for families since 1969. And so we look at Jolly Kay as the first parent leader, and at ourselves as one of the first peer parent organizations, in fact. And you could see her story and the story of others and Parents Anonymous on 60 Minutes, to the LA Times. And again, on Spectrum, even locally, as you see with Ricky and Antonia. So we believe in the work that we do. We know that shared leadership is important to changing things in America and yourselves. And so you can change. Go to the next slide, please.
You might want to move a little faster and worry a little bit about time.
Yeah. We envision a just society where all parents, children, and youth thrive in resilient families and communities. And we support the empowerment journey of diverse parents, children, and youth. We don't empower anyone. Everyone has their own power. And we do that to build on the strengths of families and communities through shared leadership to advance equitable social change, resulting in positive outcomes for all. Next slide, please. So there are 2 things that have come about for us When the COVID pandemic hit, actually, Dr. Lisa, and probably in discussions with Antonia and others, went to the state and proposed the California Parent and Youth Helpline to the governor. And thereafter was funded to do this. And it's still up and running. You could see that in the video. Lots and lots of people are still calling, they're chatting, they're texting, emailing, they're asking to be able to get into group. And they still need a lot of help. And school's coming back now. We've got not only, we've got all kinds of other things going on, from COVID reoccurring again to, interesting things with monkeypox. And so people have not stopped calling, not since the day we put the line up for them to do that. And Dr. Lisa, I think you talked about Raising the Future already, right?
Yes.
Okay. Next slide, please.
People can just read this on their own. Ricky wrote a little thing about how he's benefited, and Laura did, and Antonia wrote that. I don't think we have to read that to folks. That's for you to keep and read.
Next slide, please. I think this is just some more, again, we've talked about advocacy and shared leadership. We really have a program called Shared Leadership in Action, which is really focused on trying to help, especially public agencies, learn how to work with the people they serve, and really do that in a way that makes it easier and better for both of them. So we can go on.
You want me to talk about the research?
Yeah, definitely.
So we are a very well-researched program that talks about reduced risks, increased protective factors, mitigation of ACEs, prevention of ACEs. We've shown that parents who attend Parents Anonymous and children who attend do not increase their ACEs, which means we're stopping and we're actually preventing abuse and neglect, as well as addressing well-being. Can you go to the next slide? Because I think there's a really good graphic. So everybody knows what the Prevention Clearinghouse is. Okay, the Title IV-E. Well, Parents Anonymous in this yellow part, we were actually in shock. Not only are we in the clearinghouse, we are the only program in the nation that the federal government has decided improves all three vital areas. Okay, parenting, mental health of any kind, substance abuse, and ensures child safety. We're the only program. So we need more of Parents Anonymous to save lives, prevent the reoccurrence of abuse and neglect, and to really create an opportunity for people to build on their strengths. You can't get around this research. So we are looking to expand more and more, not only in California, but nationwide. You can advance that. This is a little summary if you want to read the journal article. This is the major study that was published in 2021, which ensured that after following people a year after they left Parents Anonymous and comparing them to people who never went to Parents Anonymous, that abuse and neglect was 2.5 times less likely to occur. I mean, it was the researchers. In order to get in the clearinghouse, you don't have to just be significant, you have to have a major effect size. Okay, this is all science, but I'm telling you, there's many, many things to lead through. That's why there are only 26 programs in the entire clearinghouse. Maybe they're 30 now, but there are probably 50 on the list they don't measure. Okay, they don't measure anything. Okay, and people are always saying, isn't it okay? We should do things that don't measure. And I said, no, I think, when I go to the doctor and they give me a Z-Pak for my ear infection and tell me 99% sure, if you follow these instructions, you're going to get rid of your ear infection. That's what people want to count on. It's not that distinct in the field of human services, but we need to say this program is effective. I didn't dream it up yesterday, and I didn't make this program up. Okay, you can change slides. Thank you. So again, as Janice was saying, we consider the helpline a first responder system. This number, 855-427-2736, hand it out. Make sure you have it on your website. Anybody who calls a family resource center, a local school, we have hundreds, I don't know, maybe up to 1,000 partners now. You can imagine during the coronavirus, the only place they had to call was a school if you had a school-age child, right? Head Start was closed. Everything was closed. The preschool was closed. And the schools were calling us off the hook. Well, what do we do? These parents are really upset. Send them to us. We have trained caring counselors who are trained to provide evidence-based Parents Anonymous over the phone. This is not 211. This is not Cal Hope. This is different. And it's for parents, children, and youth, people worried about their kids and themselves. Okay, if you have other kind of general worries, you know, there are other places to call. But people call us with suicidal ideation, domestic violence, you name it. Okay, and of course they can call, chat, and text us anytime, and English and Spanish, but I hate to say we speak every language, but not in the groups. And this is connected to certain groups. So we have people attending Parents Anonymous groups who've called the helpline. It doesn't matter where they live because our services are online. Next slide. Just give me a warning when we're 5 minutes. So Parents Anonymous has major components. So we have the 2-hour weekly support group that has 4 therapeutic principles. We incorporate 16 nurturing parenting strategies. We only do things that are based on science. We open with meditation. We use mindfulness, okay? And we measure pre and post. You don't stay in the clearinghouse without ongoing research, okay? So we have ongoing research every day. We're doing post surveys with people to measure how have parents changed and improved, and how have the children, are they flourishing or not? You can go to the next slide. So we also have weekly 2-hour groups for the children and youth that are associated with these parents. They go to their own groups. And there's a trained facilitator in every group, and the groups are divided by the developmental age of the child. You can go forward, Victoria. We also provide supportive services. So in between group meetings, we have peer specialists who link people to services. We have outreach advocates who link people to additional services. And of course, it says National Parent Helpline, but we have a national line and a local line, a state line, people call the helpline. You can continue. So as Janice started to mention, we have a national leadership certification program. So years ago, parents used to come to us, you know, this is great. I've gone to this training. But you know, I want to get a job. And, you know, I don't want to go to college. I want to do something else, but I'm learning all these leadership skills. Can you package that? And I'd say, go find somebody else. Literally 15 years ago, I told people, somebody else is doing that. And they came back and said, no way, Dr. Lisa, shared leadership, we're going to create it. And we did. So we created this national certification with 10 evidence-based research competencies. People go to at least a week of training and more. Then they do a project. It takes 6 to 9 months to do. It's a very involved process. And then people get a certificate. So it's all about developing competencies, not just skills. Competencies are the applications of knowledge, skills, and abilities. Next. And we've done extensive research on that.
Dr. Lisa, you have about 20 to 30 minutes more. So you have.
Oh, really? I can
Yes.
stop speeding? Okay.
Yes.
Okay, I'm sorry. I thought. Okay. And these are actually real people who went to the training. Shared Leadership in Action is another program. We've done that in many counties in California years ago, where people came to us and said, well, you know, we want to do a strategic plan. We want to do an initiative. We don't even know how to start to find the parents, to train the parents, to engage them in this process. And so we created a program called Shared Leadership in Action. And many counties around the state, they actually formed shared leadership councils, half made up of agency staff and half made up of parents. And we said, that's the place where you start. So this process begins with a readiness assessment. You know, it's really easy to say, oh, we want these parents at the table. Well, how do you get them there? How do you find them? What's the job? What is the role you want? So in that thing, when I asked Antonia to do something, I need to be clear. I need you to serve on a committee. I need you to review program materials. I need you to sit on a state commission. I'll tell you a little story about Antonia. She didn't want to meet me. This is years ago. I'm talking about like going back like 15 years. She was afraid to meet me. Everybody said, oh, Dr. Lisa's going to come over to the group and meet you. Oh, no. She was like disappeared. Finally, I met her one day and I said, incredibly awesome. Would you be willing to speak at this community event? She said, well, how many people are going to be there? I said, yeah, probably 100, maybe 50. Okay. So I had her, and remember, we don't ask parents to be in leadership roles without supporting them. Just like in your job, your supervisor says, I want you to do something, Betsy, right? And Betsy says the first time Betsy did it, Betsy's very experienced, it's like, okay, I'm going to struggle with this. I'm going to think about this. How can you support me? Can you look over these materials? Can I practice with you? We had all this experience, what we call guided practice. We don't call it coaching because it's too hierarchical for us. We call it guided practice, okay? We do that with every single parent. So I suggested Antonia, she write out her whole story. She gave it to me. And I said, I'm not going to read it. I'm asked one question. If this was on the front page of the LA Times, would you feel comfortable? She said, absolutely not. I told him too much. I said, good. Take it back and redo it and you can share things in general. I've struggled with my parenting in broad ways. Whatever specific you're going to share at this public event, I'm not saying it's getting into the LA Times, but I want everybody to think about that, right? Because when you share personal stuff, you need to know what the parameters are. Once you say it, it's out there. And with social media now, people videotape people secretly. People say they saw you doing something. I mean, remember, this is like 10 years ago. We didn't have as much social media, but today it's even worse. You're worried, like, who saw me? Who's saying that to? Okay. So in this process, she rewrote her story. She got it down to like 3 minutes or so. They said they had 3 minutes. We get there, there's 500 people there. I'm literally, okay. And the politicians were there. Didn't know. United States Congressperson, Board of Supervisors. This was in LA County, okay. All kinds of people. And then they introduced that 2 parents were going to speak. The first parent gets up and starts to shake and cry. And I felt so bad for them. Either this was the wrong time for them to do it, or they didn't get the support they needed, or it was a bad day and they shouldn't have done it, or they couldn't get control. I mean, I think somebody just served this person up to be on display, and my heart broke for them. Never do I do that. Never have I done that in my career. I ask people, are you okay today? Do you feel okay? Have you practiced this? Practice in front of us. Are you okay with this? We didn't know there were 500 people there, literally. That was unnerving when we walked in. I'm like, oh my God, and who's there? And so she's up on the podium with all these politicians. The woman sits down who's crying and shaking. She was literally, you know, and then Tony gets up, says her 3 minutes. And then afterwards, one of the elected officials said, I want to talk to you, Antonia. I was so moved by what you said. You reminded me about something in my childhood. Can I share it with you? I'm inspired to share it with you because of what you said. And she realized that her story, publicly saying that you have no idea who saw you on TV, right? You have no idea if you made a difference. But this one woman came up to her and said, this made a difference for me, and I want to tell you how. And that's what feeds our soul. The giving and getting of help, which is mutual support and Parents Anonymous. We do that in every kind of leadership opportunity we have. I've also been in leadership opportunities who are negative. They're not all positive. You know, parents come back and say to me, you know, they didn't treat us nicely, Dr. Lee, so don't send us to that meeting. I told the feds one, I'm never getting parents to a meeting again. You talked down to them. You didn't let them speak. Oh, I have no problem being an advocate. You need to be an advocate also. So when people call us and ask, would you bring parents, Betsy, to a meeting? You need to be quizzical and say, well, what's the meeting about? What's the role for the parent? You know, oh, we just want them to speak without you. And I never go anywhere without parents. Except unless we work together for a long time and they're going to meetings and I'm going to meetings and different, because things happen there. Do you know at the state of California, I've said this a million times, where are the parents? Why are we the only ones showing with parents? So when you show up at meetings at the county or state levels, you should have parents with you too. That's what changes the conversation. It's not like, oh, that's Antonia, she's special. And Antonia will say, I might be special, but there are a million of other people you didn't even ask to be here. And why are you putting that person on a pedestal to say they're special and putting down everybody else you never even talked to? And all these programs work with parents. If you work with parents, then you know these parents and you can ask them and provide these opportunities. I want to say one thing that's not on the screen, Janice, we forgot to say. We provide stipends. We provide training. We provide transportation support. We have flown people to Washington, D.C. to testify, you name it. We provide we do not create an economic burden asking a parent participant to do a leadership role when I'm standing there as paid staff with other paid staff. If you don't have the budget for it, don't do it. Don't assume people can get off their job. I had to write in my years, 30 years, I wrote letters to employers. Would you allow so-and-so to miss work for 3 days? They're going to come to Washington to present at a conference. And most employers said, this is really impressive. I'm going to give you paid leave and blah, 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 and do it. Because not everybody has the kind of job that people want. They get paid by the hour when they're there. When they're not there, they don't get paid. How do they keep their income for their family if you're asking them to do volunteer work that they're not getting a stipend, or their employer says, you can't have the time off because we need you so desperately. Now, this is years ago before shortage of employees. I don't know how it would work now. But it's the same thing. Want to say about this readiness assessment. This is very important. We have actual tools. When we went to a county or an agency or a school district, said we want to work in meaningful shared leadership with parents, we did an assessment and said, how are you ready? Do you have resources? Do you have a staff person assigned to do this? Do you have time for training? Have you carved out the supports needed? Do you have a role description for the parent? And what do the parents think when you ask them? And the first time somebody says, oh, somebody didn't show up. I said, well, what time was the meeting again? Oh, it was 2:00 in the afternoon. Well, most people are thinking about picking up their kids or they're at work. So that might not be a good time. And so when you schedule these things, you have to think very creatively. We have meetings at night. You know, people, depending on the age of the children on the team, we start at 9:00 because, you know, the toddlers were in bed at 7:30, but the school age kids didn't go to bed at 8, whatever time your kids went to bed. And we had to meet when they were asleep. And you have to be creative about what you're doing, or you're not creating a space for parent leaders to engage in meaningful letters. You're just talking to yourself. So you have to really think that way. You know, it's like when they put the after school, the student conferences at 3:00. I'm like, what are they thinking? Nobody works? And I can't leave work to go to the student conference. You know, I mean, are they thinking about the parents who work? They can just leave work because the teacher wants to have all the conferences at 3:00? No, they have to really think about, are you there for the parents or not? This is a problem in the schools that's just epidemic. And I think you all know that. So then we do a training. The training follows the assessment. And also in the assessment process, I want to say a goal is set. What is the goal of this initiative? Some of the counties said, oh, we're going to reduce child abuse by 20%. I said, really, in 1 year? Well, let's get real. You want to have a SMART goal, specific, measurable, attainable results, because everybody's going to feel frustrated if you come up with a goal that you can't measure, that your effort is never going to impact. And you got to be real. You got to think about the small wins. Okay? It could be opening the door for a parent leadership team to consistently, monthly review policy by such and such agency. Okay? New disciplinary problems for the schools. You know, that's been a huge issue over the years about the schools making disciplinary policies, right? And never asking the parents, well, what do you think? You know, how are you disciplining my children? The training is at least 3 days. Sometimes in Spanish, we did over 4 days, and guided practice follows. So whatever the initiative is, they set goals and a timeline, and then they implement it. So what is it you want to achieve over a year, 2 years, 3 years? And then we provide technical assistance consultation. There should be another and there. Sorry, somebody made a mistake in their English. Probably was me one night. And there needs to be an and. And we do evaluation. What difference does it make? And we have many examples in California. We had a conference years ago where counties stood up and proclaimed, now we're going to hire these parents. And they were going out hiring parents even before we said the word peer specialists, parent partners, parent advocates. I'm talking about 20 years ago or more. Okay, next slide. Okay, so what just wanted to summarize here that we have a complete packages of services, okay? So if you exist in a county and want to see more Parents Anonymous, you can contact us to design and implement a complete program plan that is in shared leadership with the local parents, not what LA, you know, Palmdale parents want versus Pomona parents or Napa parents want, right? We want to know from that community, what do they want? And the agency people together to put together a program plan. We do conduct all the groups online. We train facilitators. And of course, we have the helpline to provide emotional help, emotional support in between group meetings. And we have supportive services. So those are all the 4 components. We also recruit, train the parent group leaders. We have pre and post data that we analyze. We have fidelity tools to make sure we have quality assurance. Time and time again, you go to a group, I don't care if it's in New Jersey, I don't care if it's an online group in California, I don't care where it is inside PAN, it's the same model, evidence-based model. Nobody deters from it. And then on the bottom, can you just scroll that up a little bit, Victoria? Maybe you can see it, that we also are a Medi-Cal peer specialist program. Okay? Bye, Judy, have a good day. Just wrote in the chat. I don't know where Judy's from, but have a good day. So if you don't know, I'm telling you that California got permission a couple years ago to bill for peer support through the Medi-Cal system from the federal government. And they have identified 20 or 25 providers in the state, and we're one of them, to provide this Medi-Cal certified peer specialization training. Nobody can bill from Medi-Cal going forward unless these individuals are actually certified. They have to go through training, they have to pass tests, and maybe you've heard about it in the county you're in. And if you haven't, you can call back Janice, and that's Janice at raisingfuture.org. It's very easy. We changed our emails to just first names or shortened them. Mine was like 25 letters long, okay, for years, and people couldn't remember how to spell it. So you can go to the next slide. That's kind of what our conclusion was. And Janice, I don't know if you want to add anything about peer specialist training. And on our website now, raisingfuture.org, right, Janice? People can get on the website and see the different models for peer. It's 80 hours of training, but it's done over 2 weeks. It's done on a Saturday schedule. We have a truncated schedule. We have various different options. It's all done online, and there's scholarship money on the street right now in your county. If you don't know about this, contact Janice or Denise McCrary Brewster, who's also on the screen. Raise your hand, Denise, so everybody knows. She is the training director, and they can help you because there are scholarships out there to pay for people to go to the training and take the tests.
Right.
But that process is slowly going to close.
Right.
And so your county that you live, your program resides in has a certain number of slots for that. And if you don't know what I'm talking about, go to calmesa.org and type in peer certification, California, and all these requirements and stuff is up there, but we can surely help you with that. And if you have a group of parent partners who you've already employed at your family resource center or your sister agencies that you want to get Medi-Cal certified so you can start billing Medi-Cal, you can bring that whole group to us too. Because we're scheduling trainings come the fall or even earlier. This is all happening now. So the state of California is definitely committed to expanding behavioral health services to parents, children, and youth. Of course, we told them, don't forget about the parents when you have a child who's struggling. This is ridiculous. You cannot help a child with a mental health problem or a substance abuse problem or behavioral problem without working with the parent and helping them help the child too. It's not a one and done. Somebody goes to therapy 1 hour a week, everything's fine. It's the parent who's raising the child, and we need people to open their minds about that. And we're doing a series of focus groups for the state of California for the super agency right now. And I'll just open the door. If you know any parent who has a child up to age 26 who struggle with mental health issues and they're interested in being a focus group to give their ideas about how to change the system, we are doing focus groups in the next week, and people are paid $150 to go to a focus group, which is about an hour and a half, or be individually interviewed. Please just email me immediately. We have a whole team of people working on that recruitment statewide. We have people of different ethnic backgrounds. We're also doing focus groups entirely in Spanish for people who just want to speak Spanish. And that's going on now. And we need to hear from more and more parents. So just Dr. Lisa at Raising Future. I think it's up there. My phone number's there. I forgot to put my email down. Sorry, Victoria. We can put it in the chat. But if you want to talk about parent leadership, we do consultation for that and training, Shared Leadership in Action. We did it in many counties. We had a foundation. We had Annie E. Casey Foundation fund that. We've done training with Casey Family Programs. We did all their constituent engagement training in the last 3 years, right, Janice? And Antonia and other people did. And we are working with national organizations in their own practice. How are you really engaging parents? Not the people who are receiving the services while they're receiving the services. We do that in a Parents Anonymous group. Shared leadership is the heart and soul of what goes on. People exchange ideas, drop in their body, build community. Outside of group, what is the change and what is the community involvement or social change they want to engage?
Yeah, one of the things I just wanted to put out there, down the line of peers, is that you may have what you consider to be peer parents that are either volunteers in your organization, or they may work for you. We are developing the California Peer Parent Network. And so please reach out to us. We'll be providing training and other opportunities and, things that can help strengthen your individual parent networks. And we'd be happy to have you talk with us about that. And that's at no cost to you. It's just what we're doing through some other funding we have. And then, of course, the peer certification training, the Medi-Cal peer certification training is really a boon honestly, for organizations who want peers in their organization to help. And we are obviously peer parent leaning. So, please let us know. We'll help you find scholarships and whatever it is you need to, get people into your organization to help do the work you need to do. So please let us know.
And there's a clear recognition that peer support, the research on Parents Anonymous includes peer support. Peer support is a component of what we do, but outside of that, parents all the time are advocating. You know that if parents come to a family resource center, right, Alejandra, and they've gotten services and you don't even know, they've talked to 20 other people to school in their neighborhood. Hey, you need to go over there. They could help you do this or that. And if they don't, you're linking them to people. And so you are really an incredible hub where peers could be very vital. You may not be an agency that ever thought of applying for Medi-Cal money and being certified by an agency. You might have to find a home agency to do that, like a lead agency. And you need to talk to your county about that, how they're approaching it. So it's not mandatory in California that every county engage in this Medi-Cal peer specialist certification. But I believe 52 or 56 of the 58 counties have already agreed to start a program. And that includes the biggest counties and regionally some of the regional areas. And so having advocates out there with lived expertise and training who get certified is a job that they can take somewhere else. It will help boost their income. It will, schools are opening up for peer specialists. Everything is opening up. The mental health system is wide open for peer specialists because they are leading this peer specialists. This is not child welfare, okay? This is not the prevention. This is not the healthcare system, okay? This is, it's the mental health system that's driving this.
Yeah. Any questions?
Yeah, I think we're at that point for Q&A now. I had a few questions, but I don't know if there are other folks on the call who had any they wanted to share first. No? Okay. Well, my first question is, what are some of your strategies you have to mobilize parents in doing legislative advocacy? Do you have a lot of experience with doing that? And what is it?
Oh, yes. Since 1973, with the passage of CAFTA, we haven't stopped. So at the federal level, we're part of the National Child Abuse Coalition and many other coalitions, the Child Trauma Network, et cetera, to bring those positive messages about parents and why people need support, rather than this government hounding racist, sexist, and classist methodology, which results in terrible outcomes. The government cannot claim one positive outcome from what they're doing. Very, very little. And we know that because the numbers bear out. If you're a person of color and poor and a woman, the likelihood of you getting reported, separated from your family, traumatized, and never being reunited is disgustingly high in this country. And that's why there's a movement we're part of a movement to change the family policing network. You don't see this child welfare network. So number one, that's that. Relative to in California, we are very involved in trying to memorialize the helpline. So if you're an individual FRC, the FRC, CFRA is already a partner of ours, but we want to look at it, community level FRCs. If you've been using our number and we don't know that, please shoot us an email, Janice handles marketing. We want to put your logo on a list. So we give to the legislature and the governor, we didn't let people off the hook when I pitched this and said, oh yeah, it's just a momentary thing. The question we raised in the governor's office and with the Department of Social Services and with Dr. Galley is, what are you doing to help parents? Not blaming them and shaming them. What are you doing to help them? So this first responder system and this, we want to memorialize in legislation. We don't want to be up for conversation every year in the legislature. So anybody interested in supporting that, I know CFRA does, but individual local agencies to say, hey, we know parents who call this number, know this is access point. People feel safe sending a text, right? This is not run by the government. The government doesn't understand. The government runs things, we all run the other direction. You know, we're not quite sure we want to even go there, but we have to sometimes, right? Parents go to the emergency room, what happens? They call the police. You have a problem, you know, people are calling the police on it, people are getting investigating over and over and over and over again by every single system imaginable. If you're a person of color, low income, and particularly a woman in this country. So yes, so we have a bill that we're trying to push to memorialize the helpline and connect that to evidence-based programs. And we need more advocates to do that. We're also working at the federal level to support the National Parent Helpline, which we had legislation before. It died because one party was in charge and just pushed it aside. So, you know, there's a lot of fights going on in Congress, but we continually do advocacy. We have many people in Congress who have known us the whole time they've been in Congress. Remember, we were the only game in town in 1973. When Walter Mondale and Pat Schroeder were writing CAPTA, the only program they went to see was Parents Anonymous. There was no other child abuse prevention program. There were no other people saying, hey, I'm out of control, and now I'm not out of control. People were talking about changing their life in very raw, real ways. Her congressional testimony was not like, I'm having a bad day. No, I was in 20 foster homes. I struggled with drug and alcohol, mental issues, and this kid pushed every button and I hit her. And I didn't know where it was going to go. I could have ended up killing her. She was very real and raw. This was like, we need to do something to help parents. I love my child, separating the behavior from the person. She said this in 1973. Today, we would just, I mean, they would never have her reunite with her children. They would never. I mean, we are, the system is, the society is so judgmental now and so critical and not about helping people. Even when people are struggling, if they're lowest moment, they've tried for the 10th time to get clean and sober. They tried to get out of a violent relationship. They tried this and they feel so beaten down. Why aren't we there for them? Because we're better than them? Because we put people down? Because we're not in that? Why are you in the helping field if you have this kind of attitude? But there are people in this field in the government that is very prejudicial and judgmental and not helpful. I mean, they've done study after study. How do people get help? They got help from community-based organizations like Parents Anonymous that has an evidence-based program, and what you all do. Does the government easily give people food, clothing, and shelter when they're desperate? No. Do family resource centers? Yes. There are a lot of concrete supports. Well, they will not give up on you. Where the government would say, well, we closed at 5 o'clock. We're not talking to you. That's not what family resource centers were developed. They were of the community, in the community, trying to reach out to the community and partner with the community. But you don't want to turn it to the government. We're just pointing the finger at them. So that's a long-winded answer, but yes, we are constantly doing legislative activity. You know, we've supported the CFRA group getting more funding. I was very disappointed, as I said to Victoria, like, how did that go out at the last minute?
Yeah.
How is that going to go back in? And even when it comes to family first in the state, we all need to hound prevention, prevention, prevention. Okay, it's as though the governmental system is not sure they want to draw down family first. We're excited, right? Because for every dollar California would put up, $1 billion, they get $1 billion in federal money. Just think about the unhoused problem. How many billions they have invested in this problem and how little success they've yielded. We can show them success every time. Every parent who goes to Parents Anonymous at least 3 months shows improvement in the protective factors, mitigation of their ACEs, increased well-being, reduction of domestic violence, mental health, substance abuse, and their children are flourishing. Even during the coronavirus. Now, not as much flourishing as we would like, because particularly teenagers are grouped together in a very large group, like 12-year-olds with 17-year-olds, and the isolation, everything was very impactful. But everything is going positive. And that's what we want to see with programs. We don't want to leave people hanging and say, oh, just go to that class and everything will be fine. As I say to the staff all the time, parenting is not like cooking. Each of my children are not the same. There's no recipe you can give me. You can give me an idea of what you did for potty training. You can give me an idea of how to deal with a mouthy teenager. You can share your experience, okay? But this psychosocial interaction for a lifetime of my child is very complex, very complex. And every child and every parent and every step parent and every abuela and every auntie and everybody involved in raising kids, it's not a one and done. If you cook the same recipe for these keto, I made these keto cookies my daughter took me into, and you and I do the same recipe, the same altitude will turn out the same thing. Pretty guaranteed, right? So again, people think it's all about, people don't know, it's all about skills, and they avoid all the emotional issues that we have as parents. That's a long-winded answer, Victoria, sorry.
That's
Well,
okay.
I think there's some on the ground strategies too, and Parents Anonymous certainly does these things, but it's basic community organizing, right? You know, if you and you know, in the FRC environment, you know, if parents aren't already organizing, you want to get them prepared, like Dr. Lisa said, you know, working with Antonia to make sure when she got on stage, she didn't feel like she didn't know what she was doing. And so using the local community to start to get yourselves introduced to, you know, city councils, county boards of supervisors, you know, state electeds, and just going in there to talk about the one thing that you care about, and doing it over and over again, you know, starts to help you build that expertise in your community that gives you the, you know, that makes you feel empowered to go further and further up and out for the things you're trying to fight for. So.
And I would just add to what Janice said, every single thing they call you about, everything, or you organize. February is National Parent Leadership Month. Parents Anonymous started that like 30 years ago. And we're like, everybody uses it, okay? Use as an opportunity to celebrate parents. Every time you get invited to a meeting, you come with parents. So you're modeling shared leadership with them no matter what. So Victoria, I agree with Janice about local organizing, but you don't have to think about the state legislature. You think about the ground level, and it can be with your local officials. It could be with your superintendent of schools. There's a problem in the schools. What's going on? Some swastikas got painted at some school in Southern California. It's like, oh my God. And people were saying, what are we going to do? And the parents are worried and concerned. And obviously schools are opening this month, and they're worried and concerned about the virus, right? And what's going to happen to the health and safety of their own children. If that's not on every parent's mind who's got a school-age children, that is the front and center thing. And so parents can organize in any way. And that organization and that outreach of their own advocacy builds towards this community organizing Janice is talking about. So we say, oh, you know, we don't have any parents who would ever go to Congress. We don't have parents who want to go to the legislature. Well, you don't have to jump there yet. Just deal with your local community. And every time they call you and tell you that they have an initiative for children and families, if you can say, please add the word parent, you change the entire conversation.
Yeah.
Nobody argue with me. You know, I'm a parent. I don't think it dismisses me. And I just ignored them because I know that it dismisses me and dismisses everything. If you don't say the word parent, do you realize that every child welfare agency does not have the word parent in it? But who do they consider the problem? The parent. If you're trying to help parents, I wouldn't know by the name of your agency or your slogans. We're saving all the children from the bad parents. We're already putting down parents to start with. We don't even see that our role is to support parents. Only to there's a problem will we intervene with you. Tough luck to you if you need help before that. Because we're the government and we're just waiting for the problem to drop. It's like the police. You know, we wait for the crime to occur to investigate. We don't really do prevention. We talk about community policing. That's more like scaring people in the neighborhood, or maybe scaring the people away who are doing bad things. I don't know. But, changing that conversation and being at that table, whether it's restructuring the police in your community, dealing with what's going on at the schools, the elementary schools, the high schools. Somebody's going to put a casino, a marijuana dispensary in your town. My town we're headquartered in Claremont. They're totally fighting against any dispensary. People are like, well, why? And they said they're worried about what it will bring to the community in terms of security, cash, robberies, things like that, that dispensaries bring. You know, Northern California, you can't turn around, right, y'all? And there's a dispensary, a thing here and there. And what was in the newspaper last week? Frightening situations where kids ate edibles and were ending up in the ER. And this thing that edibles are harmless. They're not harmless to children under 18. The dosing them there is not clear. People are baking them and children are eating them and they're ending in the ER. And people are saying, it's not legal, obviously, for a child under 18 to grow a plant or smoke weed. But there are kids going to school smoking weed. But the question is, what can parents do to make sure that those edibles don't end up in your somebody at school says, hey, just eat this brownie. It's like really good. It's gonna make you feel so good. And then even tell you what's in it.
I think this is really helpful. Thank you, Dr. Lisa and Janice. We're getting ready to have our regional policy forums in September, and the big focus for those forums will be talking about how to schedule legislative visits with your local legislators. And I just love how you've talked about how you don't go anywhere without a parent. So having, providing support to our FRCs and CFRA members on how they can schedule those visits and prepare parents to come with them.
We've done hundreds of visits in Congress and the legislature for,
Yeah.
50 years and really prepare. And I highly suggest you have one simple message. Always talk about an elevator speech. I've had more important meetings in Congress in the hallway when you used to be able to walk the underground than anywhere in anybody's office. Take that moment to talk to somebody and really hone in on what you want. It's very important. People have an attention span. My daughter said yesterday it's less than 7 seconds on TikTok. It's less than a fish, or I don't know what the comparison was, but it's like 7 seconds. She said, yeah. You're saying now you got to catch people in 7 seconds. It's the same thing when you try to do a legislative pitch. If you make it too confusing, this and that, why fund this? What will it result in? Okay. And what will it save in lives and money, and trying to figure out, because the one problem we have in the FRC world, you all know, is not every FRC does the same services, right? At Parents Anonymous, we are a defined service, right? We have a beginning and an end, we have, all these things, but an FRC might be doing all kinds of stuff, might be doing other stuff. And I think that's oftentimes the difficulty of the pitch. I see, Betsy shaking her head, it's sometimes a difficult pitch to explain to people, well, what is this thing? And why would we fund it? And why do we want to have it in the community? So breaking that down to a very clear message is the challenge in any kind of legislative pitch. You can tell a long story and you already lost it. Think about the 7 seconds or 10 seconds or 1 minute.
Yep, definitely. That's good advice that we'll be providing to our members. Does anyone else have any other questions that they'd like to ask about shared leadership or community voice? No. Okay.
And my question only, Victoria, is when you say community voice, I think it would be really useful CFRA or the Equity Community Engagement Committee, I forgot the name of it exactly, to really hone that down for everybody so they know what that means.
Mm-hmm.
You mean the institutions? Do you mean the humans who live there? Who do you mean is part of this voice? And bring that 2 to 4. So I just want to end with a couple things. Number one, we are here to help you think about how to advocate for evidence-based Parents Anonymous. If you want to use our number, you're more than welcome to do that. If you want us to list you as a supporter, just send us your logo. If you're interested in peer support, Janice and Denise are the key people there, and that's on the move in this state. If you have anybody interested, literally in the next 3 or 4 days, to be in a focus group who's a parent of a child 0 to 26 who struggle with mental health issues, that's psychological, behavioral, or substance abuse, okay, who wants to be in a focus group to give input to the state with other parents about how we need to reimagine the children and youth behavioral system, please send me an email ASAP.
That sounds great. Well, thank you so much, Dr. Lisa, Janice, Jessica, Veronica, Angela. Thank you all for sharing your time with us and your expertise. If you all have any questions for our presenters, I think we have their emails in the chat. So please feel free to reach out to them. And we do have another upcoming event with Hillsides. We're kind of hammering out the details for that, but that'll be in mid-August. So keep your eyes out for the next upcoming Community Voice webinar that we'll have in August. And that'll be the last one we have, unless there are other folks who would like to do another presentation. So this is our final slide, and Sadie's going to drop an evaluation in the chat. So if you all have time to complete that, that would be great. It's very brief. If you have any questions about the Community Voice webinars, please feel free to reach out to me. But is there anything else, Janice or Dr. Lisa, team, anybody, anything else you'd like to share?
No, thank you for your time this afternoon. And we'd love to hear from you and connect with you. And again, we're doing things statewide, so we're available. Have a great day.
All right.
Thank you very much.
Yes, thanks everyone for attending.
Thank you.